Okay, so it was a general presentation about business models in health sector on case of FISTAR project. So I briefly present what FISTAR is, what are the main objectives, and I stress that this is about healthcare domain, of course, and this paradigm software to data that we want to develop it in the project. And then I also stressed that we are doing 7 use cases, which are giving us a good overview of different healthcare applications, and it also allows us to build this vertical integration between different stakeholders in the health sector. Then I also showed the motivation behind the project, so what made us to start thinking about FISTAR, so this global shift between sequential approach to patient in the center, and as well as that we spend less and less time in the hospital, so you need to be treated outside of the hospital, and so that the, let's say, cloud services seem to be quite temptative or attractive to be used. And then I also showed this Google example and showed that this public cloud didn't work, and we have this different approach, and I briefly explained how we want to make this software to data concept implemented, how to transfer these GEs, SEs, and how to build different platforms at the consumer edge and provider edge. And I concluded with some general statement that we are working on some new business models, and we really need a bit different model than typical cloud service approach like this infrastructure as a service, platform as a service, or software as a service. And we want to develop it in FISTAR, and we are working on the so-called reverse cloud approach. And at the end, I made some kind of a parallel or comparison with critical infrastructure and crisis management sector. So I briefly said that health is seen as a part of critical infrastructure, and but still people working in critical infrastructure are aware that cloud exists, and maybe their infrastructure relies on cloud to some extent, but they are aware of pros and cons of cloud. So on one side you can have this big resilience, but on the other side there are some weaknesses like single point of failure, and I gave some examples, let's say, from the ENISA report. This is European Union Network and Security Agency. And yeah, I concluded with some another example of Tetra network, which is maybe not a cloud case, but it's an example of a technology which seems that it shouldn't exist now, but it is still there, and stakeholders want to have it because it gives them, let's say, trust and some kind of backup solution. And although we all have very nice smartphones, 3Gs, 4Gs, next generation networks, still emergency services want to use Tetra network. Tetra is a trunking network, so it's for connecting those who are working in emergency services like police, fire brigades, and this is a, let's say, separate network to allow them communication. And it started, of course, as a voice communication. Now it was a little bit extended with data, but still it's much less than we usually have in our smartphones. So but this technology is still evolving. Okay, it's a difficult question. We are working on it. We see some opportunities, but still we need some more work to do it, because it looks quite complicated, and it's not sure who should pay for this kind of services, and whether it should be private or public customer, and how to arrange it. So, and it looks that it requires, let's say, integration or cooperation of different actors, which is always difficult. But we are working on it. So hopefully next month we will have some results. Okay, so we are developing an application for treatment of patients under cancer disease. And we are developing an application for, let's say, on one side, for those who are after chemotherapy, so that they can also then stay at home and be in touch with their doctor or nurses. And the other application is on rehabilitation, so when the patients are being prepared for the operation, they need to practice. So we also develop an application which allow patients to stay at home, but make it on, let's say, tele basis. And we equip patients with tablets and some sensors. And on the other side, we build some small infrastructure at the hospital site. And we just now are starting some first tests. At the moment, hospital is very, very helpful, and they also want to practice these new technologies. So we don't see any obstacle here, and it goes quite smoothly, and so we are cooperating quite well in this matter. I think it's a very important issue for them that to make sure that the data are safe. And of course, here we are just now experimenting, so it's still not so critical, but in the commercial application, it will be very, very important, and they will pay a lot of attention to make sure that these data are safe. I think it would be beneficial. However, it's not so easy to do. I think it would be rather kind of a maybe quite general framework. But there will be some instantiations dedicated to different cases, different diseases, or different scenarios. I think so that it will be rather locally operated, and that there will be kind of local communities like hospital or set of hospitals, some integrators, some service providers, and they will create kind of a local community. Local, but local means it can be regional, and I think if they will be successful, then it can expand.